Dr. Zachariah, what are some possible complications with athlete's feet?
The most common thing that we see that basically causes things like hospitalization is when you have the interdigital between the toes, digits kind of in between, they get really, really wet, and then secondary to that, you pick up a bacterial infection. And then you get something called cellulitis, which is just an infection that sends up your foot into your leg, and that can actually essentially get into your bloodstream.
Now, is that a complication that could develop after a certain amount of time? Does it depend on the type of athlete's feet you get?
Yeah, basically, the people that are more predisposed to that are going to be more of your diabetic compound, because they have what we call neuropathy, or a lot of numbness in their feet. They're unaware of stress to the feet until they have, basically fever, chills, malaise, and they look down like, what's going on down here? So that's the population we look more into. Any type of neuropathy patient, even post-chemo, it's very, very common for people to have radiation and chemo treatment to get breaches in their skin and then get that secondary bacterial infection, because they're basically being suppressed with the chemotherapy to try to fight off the disease they're being treated for.
Makes sense.